we're covering up for you, so we'll be telling you more about that a bit later. But let's talk about health. The National Health Insurance Fund's current contract with hospital care providers is set to end on 31st of January after being extended by 1 month after Medics Union vowed not to sign the new working contract, citing lack of public participation. We want to know more about this, and we want to speak to Dr. Timothy Olweni, who is the Secretary General of the Kenya Association of Private Hospitals. Thank you very much, Daktari, for joining us here on News Center, and good morning. Straight to it, what is the bone of contention between the medics and the new working contract?
Well, just in terms of giving a little bit of background, first is that the contract actually expired end of the last financial year, that was end of June last year, and have been being extended piecemeal because there were certain issues that needed to be addressed. What has been customary or traditional in the past is that given that NHIF is an insurer and they don't have medical facilities, and yet they need care for their members, it has been traditional to engage with the healthcare providers, both in the private sector, in the faith-based sector, and in the public sector, so that agreements are ironed out in advance so that there's no disruption of service when the time comes. Unfortunately, this time around, this has not happened, and that's the reason why we're in the current predicament. We have got contracts that are expiring, and providers have not been engaged sufficiently, so are not comfortable to sign the contracts currently in circulation. So we are sitting on an impending crisis come Monday next week, because providers will not have a contract and the NHIF beneficiaries will not be able to access care, at least not in the manner they have been used to.
So among the concerns raised include the reduction of benefit packages for surgical surgeries, if I'm not wrong, equally dialysis services and reproductive health services, while some health services have been omitted in the new contract. What are the implications of this?
Yeah, I agree with you. It's not even just a reduction. In general, it is almost it's a reduction across the board. We are not clear on what has advised this reduction in services because it's not realistic. In the past, even with the previous contract, some of the rates were barely able to provide. We were barely able to provide the service with those rates, and those were rates that were agreed on more than 3 years ago. So for somebody to say, even if it was to factor in inflation alone, you can't have a reduction of 50% of the previous rates that were enforced 3 years ago. So the biggest challenge, of course, and that's not the only challenge. The rates don't make it tenable for us to be able to provide service. For example, with dialysis, they have reduced the compensation from the previous 9,500 to 6,500. And we are straitjacketed to the extent that we are not allowed to co-charge. But the 6,500 doesn't even meet the basic cost for providing the dialysis service. So in the absence of there being any agreement in terms of the charges, what they're saying is in the entire private sector, assess the service.
All right, okay, Dr. Continuing, of course, now the fact that this contract has been rejected by both the public and private sector, how do we avert the crisis come next week Tuesday? Because then the extension of the contract would have ended.
I think reason just has to prevail. These contracts have to be extended in the same manner they've extended them for the last 7 months. They have to be extended. We have to be engaged. We have to iron out the issues, so that there's no need for disruption of service come next week. That's the only way we can go about it. We've talked about engagement for the last few months. That has not happened. Even in December, we wrote as a group to the CEO for engagement. The engagement that happened is, first of all, some Zoom engagement, and at best I'd say it is sensitization. And it's not meaningful to the extent that our input is not taken into consideration. So even despite that initial engagement, we were supposed to have a subsequent meeting on the rates, that they cancelled that repeatedly, and now you can see we've got to the last week. So I think there's no genuine intention for our views to be taken into account. And I think meaningful engagement has to occur, because NHIF, like I said, doesn't own facilities. So you can't promise people healthcare and don't have the ability to deliver.
What does this mean, considering this is a country trying to achieve universal healthcare?
It is counterintuitive. I don't understand what the reasoning behind it is, because we are all trying to achieve universal health coverage. And universal health coverage has got various components. One of them being access, which in the past, I must give credit, access has been increased significantly. So we've got people who are benefiting from services which hitherto they were not able to benefit. So I don't know why we'd want to cause a disruption in service and stall our journey towards UHC just because we cannot handle the administrative process of engaging providers.
All right, thank you very much, Daktari. That is Dr. Timothy Olweni, who is the Secretary General of the Kenya Association of Private Hospitals. They're just trying to shed some light on what is happening. The National Health Insurance Fund's current contract with hospital care providers is set to end on the 31st of January. Of course, after being extended by 1 month, as he explained, we will see what happens then. How do we avert this crisis, considering both the public and private health providers have refused to sign that contract because of a number of reasons, which he has explained. This is something that we will continue monitoring for you here on KTN.